You're watching the Fox 11 News at 5.
LA County Public Health has warned that the next couple of weeks are critically important. An upswing in COVID-19 cases could mean a huge impact on hospital emergency rooms, beds, ICUs, and also respirators.
Yeah, that's the big concern there. Hal Eisner has been looking into that. Is that Beverly Hospital in Montebello? Hal?
Yeah, you know, the hospitals we've contacted, everybody tells us basically the same thing, and that's that they're monitoring the situation with hospital beds very closely. This is a parade of patients went through a tented triage area down here, a tented area for patients to be looked at that potentially could have COVID-19. We want to show you that area. Take a look. When you get to this hospital's emergency area, this is the first thing you're going to see. They're going to tell you to stop. They're going to have you sit over here in seats along the wall. When you get called, you're going to come over this way, and they're going to, among other things, they're going to take your temperature. Mind taking mine real quick? There we go.
Okay, 97.5.
Okay, so I'm okay. Then you come over this way, sit down. They're going to check your blood pressure here, make sure everything is okay. Now, if you're somebody that has an emergency, like a heart attack or something serious, how you doing? They're going to send you in here to the emergency room right away if it's life-threatening. Otherwise, if they suspect you have COVID-19, you're going to end up back in this tented area. They're going to be looking for a number of different things, but if you end up having a serious case of this, you could end up taking up a hospital bed here at Beverly Hospital, and I asked Dr. Leo Lee about the availability of hospital beds.
Right now we have plenty of beds, but we are starting to fill up for sure.
What are you seeing now? More young people or more older people with underlying conditions?
We're actually seeing more young individuals without any medical problems. We're seeing families coming in droves.
And in cases, there have been families that have had to come here into this tented area. This particular evaluation room is where they can bring a patient. A doctor from the inside of the hospital can talk on a computer to a patient outside if they prefer not to interface with them one-on-one. On this side, which we're not going to show you, is where there are people that could have COVID. They're going to be tested. Back here, you've got an imaging area where people are x-rayed if it's felt that it's needed. And here you have another exam area. Cedars-Sinai also has tents. They're not using them right now, but they're also concerned about the potential upswing in cases.
We may continue to see an increase in cases requiring hospitalization and, of course, ICU care.
What happens, though, if the cases balloon and suddenly your beds start filling up and suddenly there are no beds?
Well, the plans are in place to be able to make the capacity available.
What does that mean exactly? Well, both Cedars and Beverly Hospitals say it basically means they're capable of expanding and contracting. In other words, they'll use every available space in these hospitals as needed. Will they get to a point that they might have to ask patients to delay elective surgeries? That remains to be seen. We're live in Montebello. I'm Hal Eisner, Fox 11 News.
I was going to ask you, Hal, about people who don't think they have COVID but need to go to the hospital. Some had expressed fears in the past, but it looks like they have it pretty well sectioned off that if you need to go for other reasons, you should still go.
Well, of course. I mean, you know, the whole point is a hospital has an emergency room. A hospital is prepared to deal with heart attacks and every other problem that we could end up with. And so they are set up in a way to say, you need to go this way and you need to go that way in order to keep people from interfacing that could give each other a problem. So, yes, people should go to the emergency room. They shouldn't be afraid to go to the emergency room. That's what every hospital has told me here today, Christine.
All right, very good, Hal. Thanks.